ERHMS is the Emergency Responder Health Monitoring and Surveillance System, and it's meant to protect emergency responders before, during, and after each of their deployments to keep them safe. This training is meant for anyone who would potentially be implementing the ERHMS system, so that's going to be safety officers, epidemiologists, physicians, industrial hygienists, anyone involved in the safety and health aspects of protecting responders. There's three main objectives for ERHMS, one for each of the parts. So we look at pre-deployment, during deployment, post-deployment for each individual worker. Pre-deployment, we're looking at identifying all the responders who could potentially be deployed, and then determining that they're fit for deployment and determining what their deployment role is and that they're trained to do their job. During deployment, we want to make sure they're safe. So that involves monitoring for exposures, injuries, and illnesses. And if anything is identified, intervening with new personal protective equipment or whatever's needed to keep them safe and keep them healthy so they can keep working. In the post-deployment phase, we're looking at identifying which workers may need long-term health monitoring or surveillance and which ones don't.
So the ERHMS system is based on a collaboration of many different agencies involved in a response. We're part of the incident command structure, incident command system.
The coordination is important because in events there's oftentimes multiple jurisdictions, multiple agencies all working together, and the more we can build relationships and interact ahead of time, the smoother things will go in an actual event.
To me, ERHMS is a new way of thinking about the safety culture during a response.
After the World Trade Center attack, we didn't see until later on in the event that people were starting to develop long-term health effects.
That was a mega disaster where responders came in from around the United States, not just New York itself, but they came from every state and every community, within 1,000 miles. There were so many workers there that it was difficult to even know how many workers were there, and they were working very intensely in dangerous areas where the need, the urgent human compassion to provide emergency response kind of overrode the common sense to stand back and say, can we do this in the safest possible way?
So worker health and safety is the core factor because all of the responders are valuable assets to the response.
Having a way to know who those workers were, have some way to measure what they actually did on the job site, and whether or not those were dangerous activities. It gives you the chance to go back retrospectively and target individuals for follow-up.
We want to protect responders, and we think of responders as being everyone who's involved in an emergency response, from the first responder who arrives on the scene to the last construction worker who leaves.